Welcome to today's global update, and it is global in the most literal sense of the word today. We're kind of going to do a bit of an overview. Now, before we start this, I think we need a bit of context. I'm going to start off with a bit of context. What is it in the world that's killing people before we look at COVID specifically, and just how big a problem COVID is compared to everything else? Now, this is the 10 global causes of death in 2016, for which full data is available. So it's good to see that. And we see that the most common cause of death is ischemic heart disease, then stroke. So that's poor blood supply to the heart, that's poor blood supply to the brain. Then chronic lung diseases, chronic obstructive pulmonary disease. Then lower respiratory infections, the ones in red are infections, and neonatal things. Then Alzheimer's disease and other dementias. Then diseases of the upper airways and lung cancer. Diabetes, road traffic accidents, diarrhea illnesses and tuberculosis. Now we might come back to that later because that's pretty useful context for where we're at. Where does COVID rank in this? And just to give you the bottom line at the moment, it's about 6th. In that ranking at the moment, if you don't want to watch the rest of the video, but it's much more complicated than that. But stick around, it is quite intelligible. So now these top 10 causes of death in 2016 accounted for 57 million deaths worldwide, and that was 54% of the deaths worldwide. In other words, the other 84% of deaths was from numerous different causes, not just that one, not just those 10, from hundreds of different causes, but they were the top 10. So I thought that was interesting and relevant. Now, the data I'm going to do today comes from the Institute of Health Metrics and Evaluation, independent global health research organisation based in Washington up in Seattle. Rigorous and comparable measurements of the world's health problems, and the other thing I like about it is it evaluates the effectiveness of strategies. So, okay, here's the problem. Here's the problem. We know what the problem is. What the heck do we do about it? And is what we are doing about it efficacious, effective, cost-effective, and all those other things? Right, now to get onto the topic of COVID specifically now, let's start with this global review. And this was published about 3 days ago. So this is bang up-to-date information, based on statistics from all around the world that I wouldn't possibly have the time to collate myself, but they put it together for us, so that's kind of them, thank you very much. Now, the cases at the moment, in terms of new cases per day, roughly remaining constant. About 250,000 new cases per day since August, so every day since August, about 250,000 new cases. 1 million new cases every 4 days, in other words. This is globally, of course, this is the whole world. Now, approximately 1 in 10 infections has been detected. So, interesting, what they're saying here is for every infection, or only 10% of the infections that exist in the world have been detected. So, the official figures at the moment are 31.5 million diagnosed cases. This means that because many are not diagnosed by testing, that the actual number of people who've had COVID-19 so far are 315 million people. And even that could be an underestimate. Because in some countries testing's good, in other countries it's not so good, as we know. But that's their estimate for the whole pandemic so far. And even in the UK, the testing was picking up about 1 case in 50. At the start. It's picking up a lot more now. It's probably picking up 50% of cases now. But at the start, it was picking up hardly any of the cases at all. So they've kind of taken an overview of that, taken cognizance of all that, and this is kind of what they've worked out. So it's quite clever, really. So there's probably been about 315 million cases so far. Now, if we assume there's 1 million deaths, which is, again, probably a bit of an underestimate, but that will give an infection fatality rate of 0.32%. There we are. So this infection fatality rate of 0.32% is not too far off from the figures that we've been looking at for the UK, for example. Not too far off at all. Interesting. This could be roughly what the fatality rate is on the mixed world global population. We seem to be getting closer to a figure now. Of course, it's going to be more in older people, less in younger people, but the world's made up of mixed population, of course, so that could be roughly how it's going to balance out. 0.32. Of course, if we only took the cases we'd recognise, that would be 10 times that. That would give us an infection fatality rate of 3.2%, and thankfully it's nowhere near that high. So 0.32% on the best global, it's more than guesses. It's a very educated guess that we can get at the moment. That's kind of the global infection fatality rate, and probably what we can carry on looking forward, well, not looking forward to, but what may continue happening, as we're going to see. Now, daily deaths from COVID are declining, just over 5,000 a day in the last week. They've been going down for some time now, largely due to the seasonal effect of less cases being transmitted in summer. So that is good. Cases are declining, making COVID the 6th leading cause of global mortality. So this is where we're at now, the 6th major cause. Now, just to remind ourselves, from the 2016 data, that will put us 1, 2, 3, 4, 5, 6. It will put us kind of just above diabetes mellitus, just above lung cancers and these other diseases. But that would mean at the moment that diseases of lung cancer and upper airway diseases are more common, dementias are more common, lower respiratory infections are more common, chronic obstructive pulmonary disease from smoky environments is more common, stroke is more common, and ischemic heart disease is more common. So the question this raises in my mind is, given all the global outcry about COVID-19, rightly, but where the heck is the global outcry about all these others? Why is there not a global outcry about tuberculosis that's killing people unnecessarily? Diarrhea illness, mostly caused by gastrointestinal infection. And of course, the problem with diarrhea illness is it mostly kills children. Road traffic accidents, but why is more not being done to prevent road traffic accidents? You know, this is like the 6th major global health problem at the moment. So that's on the current data at the present time. Now, progress is being made in Latin America. It's getting better, apart from Argentina, which is not doing well. Surging cases in Europe, and surging is the operative term. There's a lot of new cases coming in Europe, and continued epidemic expansion in India, sadly, and the rate of which we are not entirely sure of. So that is what is happening now, in a nutshell. Now, what can we expect? Now, unfortunately, there's decreased vigilance. Many people are just getting fed up of this, and they're not taking the precautions as most people in the world now know they should. That's why I put this poster up every day. But people are getting fed up, so decreased vigilance amongst the public in many countries is going to be a problem. Is a problem now, is going to be a bigger problem potentially in the future. My job, of course, your job, is to propagate these simple health messages so that it doesn't become a problem. We want it to go away as everyone is more vigilant. Simple things, cost-effective measures. Most of them don't interfere with our lifestyles too much. Let's do them. Northern Hemisphere seasonality will lead to a major global surge in daily cases. Respiratory viruses spread more in winter. We know why. We're shut in. We close the windows. We put the heating on. We lower the humidity. We dry out the air. We don't go in the sun. We don't get the vitamin D, and we congregate in closed spaces. So we get more respiratory viruses in winter. So that's going to lead to a surge. There you go. Simple fact. It's going to lead to a surge. Is now. Let's hope the mitigation measures that are taking are going to mitigate that. But we can expect a surge, unfortunately. Let's not be fatalistic about it. We kick and fight against it, of course. But nevertheless, globally, cases are probably going to increase. And that's going to result in increasing deaths in November and December. Now the projections, remember deaths at the moment down to 5,000 deaths a day at the moment. This is probably going to rise to 30,000 deaths a day in December. Dramatic increase, because most people are living in the Northern Hemisphere. It's going to be winter in the Northern Hemisphere. This is probably what's going to happen. January the 1st, 2021, total deaths will probably reach 2.6 million people. That's another 1.6 million people probably going to die of COVID between now and the 1st of January. Our job is to reduce that as much as we can, of course. And that would make it the 4th leading cause of death. Now let's just look at that in terms of the totals. So 1, 2, 3, 4. So it would be there with lower respiratory tract infections above these other conditions. So still chronic obstructive pulmonary disease from smoke, stroke from bad blood supply to the brain, ischemic heart disease from bad blood supply to the heart would still be killing more people than COVID-19, even at this predicted peak. So let's look now at the global deaths for 2020 so far. This is the situation so far. So in 2020, most people in the world have died of ischemic heart disease, second stroke. And what this data this is done from the World Health Organization is they've logged the COVID deaths in with the lower respiratory tract infections. Because remember, there was quite a lot of lower respiratory tract infections anyway. But now we see that this is increased. If we can compare these side to side, we see that there's now more in 2020 compared to, I can click the right button. So that they were the numbers of lower respiratory infections in 2016. This is the bigger bar here in 2020 because of the additional COVID deaths. So that, just a minute, gone completely to pieces here. There we go. So what this would mean is it would be the 4th leading cause of death in the world for this period of time. Now, of course, the COVID's going to go away. These other conditions aren't going to go away anything like as quickly, so we'll still have these. So let's hope we can start making progress towards reducing these other causes of death as well. Now, I know people have got to die of something, but very often the people that are dying from these conditions are dying very prematurely. Tuberculosis, for example, often in young people, HIV in young people. As we've said, diarrhea illness very often in under 5s. We're not going to be bored after this pandemic, that's for sure. There's still going to be plenty to do. So that would make it the 4th leading cause of death in January. Not good, but that's where we're going. Now, questions often asked about the herd immunity strategy. Now, I just want to say a little bit about herd immunity. I'm sure you know what this is, but I've just drawn a picture here if I can fit it in. So here we have an infected person here. Now, if this person here is immune, then they're not going to get the disease. They're going to be okay. They're not going to get the disease. They're not going to get the disease. They're not going to get the disease. But if this person here is vulnerable, they can get the disease and they can then pass it on to other people and we get this chain of infection. Likewise here, this initial person could pass it on to him, who passes it on to him, who passes it on to him. He passes it on to her, who passes it on to him. So that's what happens. But the disease doesn't spread if the infected person is exposed to people who are immune, because they don't have it, therefore the disease doesn't spread. That's the end of it. That's the end of that process. Because what happens is this virus can only replicate inside human living cells. Okay, you could pass it on your hands for a short period of time, but basically the virus, but it's absolutely true to say the virus only replicates inside living human cells. So that's with no herd immunity. But if we do develop herd immunity, so that's no herd immunity. If we have herd immunity, then what will happen is there's an infected person there and that person is immune. So they're not going to get it, therefore they can't pass it on. So the infected person here is essentially surrounded by a firewall of non-infected people. so they can't pass it on. But even if there is one person here who is vulnerable, yes, they can get the infection, but they're not going to pass it on either because they're surrounded by non-infected people. And of course, after that person's been infected, that person will turn blue. They will become immune, so they can't get it again. I know about 4 people in the world have got it again, but we can basically ignore that. It's so rare. So that's what we mean by herd immunity. So how does this play through into strategies? So herd immunity, or community immunity is really a better term, but this is the existing terms, even though it reminds us of cows or something. But it does refer to people. Now, up to 70% of individuals can get this infection in a situation of near random mixing. So there's been a few cases on boats and things where 70% of people have got it, mixing randomly. So it looks like if we do nothing, and there's just random mixing, you go to the pub, you go to work, you meet your girlfriend, whatever it is, all these things, just random social interactions, because we're social creatures, will result in 70% of the population being infected. And because we're a global world, that would now mean 70% of the world's population being infected. So up to 70% can be infected, could be infected. Now the actual percentage is probably a little less than that, because some people seem to have a degree of pre-existing immunity. Not quite sure why yet, probably due to previous infections, maybe influenza, maybe other respiratory viruses, more probably other coronaviruses. So the actual number of people that could potentially get it is probably nearer 65% than 70%, although that is not an evidence-based figure, but it would make sense. Now, if there's no further government action when the winter surge begins in the Northern Hemisphere, deaths by the 1st of January are predicted to reach well over 3.5 million. Whereas if we just carry on as we are, we're looking at just over 2.5 million. So the interventions that are being taken by governments around the world are potentially saving 1 million lives between now and the 1st of January. But this is quite a profound statement here. Mask use can save more than 730,000 lives by the 1st of January. That is pretty impressive, isn't it? That is a lot of lives to save. Getting on for 1 million lives can be saved if we all wear masks. And that assumes that about 95% of people are wearing masks when they're outside in social situations. Simple, cheap. I've got about a dozen masks now, I'm sure you have. Just wear them, put them in the washing machine. You know, we remember our mobile phones when we go out. We'll just start remembering our masks. Always have it with us. There's a couple of spare ones in the car or on your push bike or whatever. Just get in the habit. You know, it's a new normal for a period of time. My Prime Minister yesterday said it's the next 6 months. So he's probably... Actually, that's probably going to be about right. Probably going to be about right for the next 6 months. So wearing masks can reduce deaths by 43% of the deaths expected between now and the end of 2020. Now, more thinking about herd immunity, multiple locations in Latin America are now at over 40%. Now, the reason I put this in is there's been some talk on social media that herd immunity will kick in at about 20%. Well, it won't. It won't. I was optimistic about, well, you're going to get some benefit. I mean, the more people that are immune, the less transmission is going to be, but they're still going to be spread. And the reason we know that is several locations in Latin America where there's a lot of spread have now got 40% infection. So we know that the infections are still spreading at 39% because we're now up to 40. I would imagine we'll go up to 41 or 42. We don't know that yet because it hasn't happened. But I'm afraid I see no reason why not. I'm expecting herd immunity to peak out at around about 65%. So specifically, that's happened in Ecuador and Mexico City, indicating that the percentage increases at least to these levels. So the percentage goes up to at least those levels. So wherever you are now, with ongoing spread in your area, we can say that infections will get up to 40%. That's what we can say pretty well for sure because that's happened already. And we're saying it's likely it will go on to about 65%. Now, let's assume that herd immunity, let's assume that these cities in South America have reached herd immunity and there's no more spread. It's not true, almost certainly not true, but let's assume that's the case. If herd immunity at 40%, which is ludicrously optimistic, it's not going to happen, but if it did, then we're less than a quarter way through this epidemic by the 1st of January. And that would result in 10.4 million deaths, based on projections at current infection fatality rates. If herd immunity is not reached till 50%, which is still very optimistic, I'm expecting it to be 65, remember, then that's going to result in 13.1 million deaths. And remember this saying from our world in data, only if we end the pandemic everywhere can we end the pandemic anywhere, because we're going to get backwards spread. So that's kind of where we're at. Now, of course, what I believe will happen is the vaccine is going to cut this short, or half a dozen vaccines are going to cut this short. But if not, I did a quick back of the envelope calculation actually when I was prepping this. The 60-65% herd immunity, we're looking at something like 15 million global deaths, very, very roughly. Because this getting herd immunity at 50% is optimistic. But there's another really important thing to say. This is probably the most important thing I've said in this video. Herd immunity is additive with these measures. So hygiene, face masks, physical distancing, limiting our social interactions, these add to herd immunity. So the infections are going to be reduced, new infections are going to be reduced by herd immunity to some extent. So like in London, where there's about 17-18% herd immunity now, that's going to have some minimal benefit, some benefit. Add that to it and you get an additive effect. So herd immunity, even at limited levels, plus all these social distancing measures, because the virus can only reproduce inside human cells, give an additive protective effect, slowing down the transmission, reducing the deaths until we get a vaccine. So that's that bit. Should we do a bit more today? Is that enough? We'll do a little more today. I'll just do this briefly. Flu, influenza's coming. It does kind of fit in with the winter virus kind of thing we've been talking about. Professor Jonathan Van Tam, something like Deputy Chief Medical Officer, so some big bod anyway in UK medicine. Now, having flu and COVID-19 together, we know significantly increases the chances of death because it's a double whammy. Now, he's only talking based on 58 people that we studied back in March, April, from the early phases of the pandemic, and these were people that were hospitalised, so they were already sick, who tested positive for both viruses, that's influenza and COVID-19, and these people became very ill, no two ways about it. Now, these are hospitalised patients, so the death rate at that time, which is now low, but the death rate at that time was 26.9% if they only had COVID, but if they had influenza as well, it was much higher. So it's going to be really important that people don't get influenza and COVID together. This means if you think you might have COVID during the coming flu season, which basically starts, well, when does it start? Next month really, late September, October, certainly November, December, January, it's raving then. If you have any symptoms that you think might be flu, you've got to self-isolate just in case you get COVID at the same time. And if you think you might have COVID, you must immediately self-isolate because, well, you should anyway to stop the ongoing spread. But if you go out and then you're exposed to flu as well, there's something like a 43% chance according to this. Depends on other cofactors. But anyway, it's basically you don't want the double whammy. I can't give you figures, but you do not want to get it at the same time. I'm optimistic because all of these measures that we're taking work just as well against flu as they work against COVID-19. They work against both. So these really are a win-win situation. And Australia, due to the precautions being taken in Australia, we looked yesterday how Western Australia is basically cut off. Western Australia is like an island. from the rest of the world. No community transmission for 5 months, spectacularly successful. So Australia generally has had the best flu season it's had for decades because of these precautions that are working against flu as well as working against COVID-19. So, but still, the risk is there. The risk is there. We have bad flu seasons and we have good flu seasons. On A&E, January, February, you get so many people in with influenza, then superimposed bacterial secondary infections. Especially if they've got a pre-existing chronic bronchitis, you get this acute on chronic phenomena. You get dozens of people. It's just such a common thing. And this time we have to make sure we don't get both. So if you think you've got one, make sure you don't get the other. And don't spread it around. The government's ordered 30 million doses of the flu vac in the UK. And Dr. Fauci, on his interview recently, said the United States he did not expect the United States to run out of flu vac. So all governments are frantically advocating. All governments, certainly the United States and the UK, are definitely advocating flu vac. And I agree with the government strategy on this and hope to be able to get one myself at some point soon. So 50 to 64 in the UK are going to be offered it, plus children aged 2 to 11, because classically, of course, children catch flu at school, take it home to mum and dad, take it home to grandparents, and essential workers are also planning to be vaccinated as well. So there we go. One to be aware of. Now, I think we'll just finish off with a couple of... I get so many emails and comments, I just can't respond to them all. Literally, I just couldn't. But it's good to look at a few illustrative ones. So one of the things I've often talked about on this video is the effects of culture on disease spread. Now, of course, I don't have a culture, whereas everyone else does. So my way of life is completely normal. If you live in another country, you've got your own culture, and that's different. But I don't have a culture. I live a normal life. And everyone thinks that, of course. Of course, we all completely have our own culture. Of course we have a culture. But you don't see your own culture. You think it's normal. But in actual fact, it's not. It's your culture. You think the way I live is normal. It's grossly abnormal. It's dictated by English culture. Just that I don't realise it because I live in it. So we've all got a culture, so it's sometimes good to be aware of that. So just a few emails. I'm Dutch. True, nobody wears a mask. People look strange at me when I wear one. That is bad news, isn't it? So people not wearing masks in the Netherlands. Bad. We know. Well, heck, I mean, how much more evidence do you want? Was it nearly 780,000 deaths or something prevented by it? Now, this is not my views. These are just views of people that have written in. I'll just leave you to freeze frame that and read it if you want to. Again, not my views, just people that have written in. You have to consider their opinions legitimate, though. Right, a significant proportion of the United citizens literally are anti-scientific. Now, this is concerning. They don't send their children to public school. They avoid the teaching of evolution, climate science, microscope use, health, sex education, and can also escape childhood immunisations by homeschooling. America's funny. It's the most brilliantly scientific country in the world, and yet there seems to be a few people that miss out, and there's a lot of anti-science feeling. I do pick up a lot of anti-science feeling, I must say, from American communications. I mean, not all. I mean, the vast majority are very good scientists in America, but there does seem to be this undercurrent of anti-scientism in the States. I don't know, I don't live there, but that's my impression, that we don't really have to the same extent in the UK. Most people in the UK know nothing about science and aren't interested. They're not anti, they're just apathetic. Is that a cultural difference? I don't know. I can only say what it's like in the UK. But these are what people are saying. So people can attend college without basically having much basic education. They need remedial maths and English sometimes, but there's no remedial science or remedial health education. So I thought that was kind of interesting. One more. If we can fit it on. Yes. Yeah. John has on so many occasions lauded the scientists who are employed by the World Health Organization, and yet seems befuddled when they conclude the opposite to what he's concluded. Fair point. I'm not a big fan of the international agency either, but I do doubt they are complete dolts. Fair point. If there's one thing we know, it's that we still need to know more than we desperately, absolutely want to know about this virus and our response to it. Absolutely. So there you go. So always good to get constructive criticism. Do keep it coming in. Okay, right. A bit longer than I expected today, but if you've stayed with it, thank you as always.